The human saliva is complex fluid that contains various components and perform several important functions. In general, saliva comprises about 99.5% water. Other components are enzymes, mucin, electrolyte, antibacterial agent, having potassium ion about 7 times the plasma and sodium ion about 1/10 of the plasma. Calcium and growth factor are main component of the saliva. The pH of saliva is about between 5.6 to 7. Now component of saliva. First is water. Water is saliva's primary component, making majority of the volume. Second component are enzyme. Saliva contains enzymes such as amylase, which helps break down the carbohydrate starch into simpler sugar into maltase. Mucin, these protein help lubricate and moisten the food, aiding its passage through the digestive tract. Fourth component is electrolyte. Saliva contains electrolyte sodium, potassium, chloride, which help maintain the electrolyte balance in the mouth. Fifth is antibacterial protein like lysozyme and immunoglobulins, which protect the mouth and prevent the infection. Six components are anticoagulant. Saliva contains substances that prevent blood from clotting during chewing of the food. Seventh component are buffer. Saliva help maintain pH in the mouth, preventing tooth decay by neutralizing acid producing by the bacteria. Eighth component are growth factor, which assist the repair of the tissue damage. Action of saliva. First is moistening and lubricating fluid. Saliva help to soften and moisten dry food, making it easier to chew and swallow. Second is digestion. Amylase in saliva initiate the breakdown of carbohydrate into simple sugars. Third is protection. Saliva helps protect the teeth from decay by neutralizing acid and prevent bacterial growth. Fourth is speech. Adequate saliva is necessary for clear and effective speech. Fifth is antibacterial property. Saliva contains enzymes and protein that can help inhibit the growth of harmful bacteria in the mouth. And sixth is oral hygiene. Saliva help cleaning the mouth and washing food particle and debris from the oral cavity. The daily salivary production about 1 to 1.5 liter per day and basal rate is about 0.0012 to 0.2 ml per minute per gland. When stimulated, it is about 0.18 to 1.7 per ml per minute per gland. But minor salivary glands are constantly discharging their mucin, which is main function is oral lubrication and with the constant rate without affecting by the stimulation or destimulation. So these minor salivary glands are constant without stimulation discharging their mucin for oral lubrication. Normally, submandibular gland secrete about 69%, parotid 26%, and minor sublingual gland about 5% of saliva. In resting stage, means unstimulated. When these glands are stimulated by food or any chewing substance, the parotid gland secrete about 69% and submandibular gland about 26%, sublingual gland about 5% of the saliva. It means reversal happen between the parotid and submandibular gland. In stimulated phase, parotid gland having more contribution. The concentration of the sodium increases with the salivary flow while the potassium remain the same throughout the salivary flow. Normally sodium is about 1/10 of the plasma and potassium about 7 times higher in the saliva than the plasma. So this concentration of electrolyte is vary in the saliva than the plasma. Saliva secretion is a complex process controlled by autonomic nervous system. The sensory stimulus like sight, smell, trigger the sensory receptor in the mouth, which lead to activation of the brain, which function through the autonomic nervous system activation, having two parts, sympathetic and parasympathetic nervous system. Parasympathetic stimulation primarily by the cranial nerve, seventh glossopharyngeal nerve, promotes saliva, and these stimulation act through the superior inferior salivary nucleus, and sympathetic control coming from the superior cervical ganglia through the plexus around the carotid system, leading to stimulation of the salivary flow. And acetylcholine, which bind on the end receptor, ultimately lead to activation or production of the salivary secretion.